Welcome back to the Takeout. Welcome to the Conversation Corner. Health experts, I know that's a loaded term in these contemporary political times, and some Republican lawmakers taking issue with the administration's new position that Tylenol used during pregnancy could contribute to autism. Here was the president on that matter Monday at the White House.
Taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary.
Administrator for the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz, joins me now. Dr. Oz, great to have you here. Thanks for joining us.
Thank you very much.
Synthesize for my audience what the federal advice here is on this. Is it to never take Tylenol under any circumstance?
Categorically, no.
Okay.
The advice actually that the president gave in that little piece is pretty accurate. If you've got a high fever, if you've got big problems that are worrisome to you, and hopefully you'll contact your doctor if that's the case, they're going to tell you to take Tylenol for the fever because we don't have a lot of other options, and the fever itself could be a problem. The concern here is that I believe most women get low-grade fevers, they stub their toe, they have little aches and pains, and they think it's perfectly safe to throw a couple paracetamol or acetaminophen or Tylenol when they're pregnant, and I don't think that's the case. And here's the real question, Major. If you're where we are right now, and the president charged us to find out what's going on with autism, why is it we have 5 times more autistic children than we had 25 years ago, which is clearly not genetic? There's something environmental happening.
From your opinion, it's clearly not genetic.
It couldn't shift 5-fold in 25 years. Genes don't do that.
Is any of that related to a more precise or expanded definition of what autism is, meaning the spectrum enlarged, and children who might not have fallen into that categorization, say 15 years ago, now fall into it?
I'll grant you there's a possible creep there, but let me ask you a question, because we're probably similar in age. How many children in your class or in your environment, your neighborhood, had autism when you were growing up?
I didn't know any.
I didn't know any either. Secretary Kennedy often recounts that he's never known anybody to his age group. And so where are all the 60, 70-year-old autistic people? There seems to have actually been a real change. And then the question is, what's going down? And when we were asked to look into this, we broke the silos down between the FDA, Marty McCary, who's been on the show many times, Jay Bhattacharya, NIH, myself at CMS, and we did the best we could to figure out, looking at the best science out there, what are the clues? And we figured 2 out. Now, there are going to be more. This is evolving.
And these are clues, not conclusions.
Signals. These are things that we believe that if you're fully transparent about, you'll rebuild trust with the American people. Just tell people what you know, like a doctor.
The 2 clues are?
That we believe that kids with autism spectrum disorder have a problem getting folate into their brain in some cases. That's a problem that could be treated with a medication that's a prescription drug that a doctor has to prescribe for you by definition called leucovorin. FDA is going to change the label on this drug over the next few weeks that will free up state Medicaid and CHIP services, which they insure most kids in America, to allow children and their moms to get access to this medication.
Because there's some small data sets that say this could be helpful. Leucovorin.
There are about 250 kids in different trials. But that's the key question is, if you, as a researcher on those trials, had a child, would you give that child leucovorin? And when I asked the doctors involved in those trials, they said yes. In fact, academic centers who are researching this, I got the same answer. So we don't have all the answers, but we feel obliged to tell the American people this. And who really was passionate about this is President Trump. He said, if we know this is a possible tool, why would we not tell the American people? Tylenol, same story. The Tylenol issue is whether or not we should warn moms who are pregnant today about a problem that we may not know fully the answer to. Is Tylenol a problem during pregnancy for another 5 years? Well, what about the kid today? Are you going to take the Tylenol or not? And I think the answer, the best prudent answer is, of course, take it if a doctor says you need it. But don't take it on your own without thinking twice about it.
Respond to this. This is something that came from the Coalition of Autism Scientists, saying, it alarms us researchers, meaning what the president said, who have committed our entire careers to better understanding autism. The data cited do not support the claim that Tylenol causes autism and leucovorin is a cure, and only stoke fear and falsely suggest hope when there is no simple answer.
They believe that we should keep secret these clues until we have all the definitive studies done. I'm an academic doctor. I was a professor at Columbia University, now emeritus. Jay was a professor at Hopkins, at Stanford. Marty, a professor at Hopkins. These are 3 top-tier institutions, all of us tenured faculty. I know what academic research is. But what are you going to do with the mom right now? In our moment of need, we cannot be surrounded by intellectuals. You have to have people who can make decisions, people of action. The president said, I will not wait one more day if we have a clue that the researchers themselves believe would change their actions. And so we're guarded in saying we don't have all the answers, but if it's my family, I'm not going to have my pregnant daughter take acetaminophen if she doesn't need to be on it without certainly talking to a doctor about it. And if I have a child that's autistic, I'm going to try this prescription drug, leucovorin. Try it for 3 months. If there's an improvement, keep going. If no improvement, stop it. These are the research tools that we have developed. We've written about it, and we've published it.
And you believe, Dr. Oz, this provides clarity, does not add to confusion?
If people want to be confused, it's easy to find a path to get there. I come on shows like yours because I think what I'm saying is understandable. There are political reasons why people don't want to understand it, and I want to highlight this reality. If you mix politics and medicine, you know what you get? Politics. You kill medicine. This is not to be a politicized issue. Let me ask you the big question, Major. Why would the president talk about this? There's no political benefit to him. He did it because he cares deeply about these children, and he doesn't want the American people hurt. And most importantly, he wants to be transparent about what we know, which is why he sent us out there, knowing that it's 5 years before we have the final answers that those researchers who are looking for the ultimate perfect result are expecting. But as a surgeon, you have to act in the moment. That's what we did.
So very quickly, Dr. Oz, Tylenol does not cause autism.
Taking Tylenol chronically while you're pregnant could cause autism.
Okay.
I don't think we should mislead people on this issue at all. I don't believe, based on the research that I read, most recently a large study from the Harvard School of Public Health last week of August published, you would not want to take Tylenol unless you really needed to take it. What does that mean? It means in pregnancy, don't take stuff if you don't have to. And if you need to take stuff, talk to somebody about it, like a physician you trust, and then, of course, medicate yourself accordingly. But pregnancy is a very delicate time.
Very delicate.
And there are very few medications that you can really be comfortable taking. Even acetaminophen, the company itself says we're not advocating that you take it. But it's the only thing out there. So if you've got a high fever,
consult your doctor and read in on that. Okay. You're head of Centers for Medicare and Medicaid. Medicare fraud, 2 components: foreign actors and then large institutional healthcare providers in this country. United Healthcare is in the barrel on this civilly and criminally. What are you doing to deal with it? How big a problem is it?
It's a very large problem. Let's take the criminal actors first. There's large multinational syndicates that have been able to defraud the U.S. government. Why? We're a massive
We're talking
target.
about billions of dollars.
Oh, $15 billion was the last action we had with the DOJ recently. And just to explain what goes on, you need a Medicare beneficiary number, which everyone over 65 has, and you have a $1.7 trillion piggy bank, a piggy bank that's twice the size of the Defense Department. So all you need to do is that number to pierce the system. And if you're sophisticated, and these multinational criminal organizations are very sophisticated, they start to draw down money. They pretend they're sending out wheelchairs. They send drug bills that aren't legitimate. They pretend people are alive who aren't. They manufacture expenses. They collect all that money and get it offshore. And as soon as it leaves the country, you can't get it back. So the group that we busted, the $15 billion bust, the criminals are mostly back in Russia. There's a large syndicate that's doing hospice fraud. I'll give you one that's going to blow your mind. Durable medical equipment. That's the knee braces, some of these skin bandages. There's more DME suppliers in South Florida than McDonald's, I am told. I mean, are you kidding me? Now, these
DME, durable medical equipment.
Durable medical equipment. They're selling you braces and wheelchairs. So these folks start the companies, then they flee back to Cuba. So we never actually can catch them. We want to change the system. We want to do 2 things. One,
AI does that how?
Bingo. AI can tell us ahead of time based on patterns of spending. People who've never spent money suddenly spend a lot. You open a bank account. You don't have any inventory. You don't have any payroll. You're sending huge bills into Medicare. What gives? So we can identify fraud as fast as the fraudsters create these schemes and shut them down that rapidly. But we are aggressively pursuing these. Same thing, by the way, if you're looking at inappropriate billing or upcoding, all these little games that are played, we can now do exactly what the large companies have been doing in other walks of life. The same techniques banks use to catch fraud, we're starting to use. And we have a fraud war room that's just wonderful.
United Healthcare, Medicare Advantage. I know you're an advocate of Medicare Advantage. That someone takes advantage of Medicare Advantage doesn't mean Medicare Advantage doesn't work. Yeah. But United Healthcare is in the barrel.
They are, and they've come and spoken to just about everybody about the changes they're making to their company. But I'm interested in something much bigger than that. I want the ability of the Medicare beneficiary to choose the coverage they want. And I want whatever coverage they desire to be the right coverage for the American taxpayer, too. They should be affordable. They should be efficient. The most important thing we do at CMS and Medicare is provide high quality care. And here's why, Major. The most expensive care of all is bad care. Because I pay someone to do a bad job, then I pay someone to fix that bad job, then I get paid for the complications. So we're interested in quality. And I want to go after every one of these groups, the traditional Medicare, the Medicare Advantage, even Medicaid. We should be providing better quality care. And part of what we did in the One Big Beautiful Bill was to make it easier for us to root out the fraud, waste, and abuse in the system and just focus on providing the most money at the point of care, get more primary care doctors taking care of patients. And the best example is the $50 billion that we're putting into the Rural Health Transformation Fund. That's twice as much money as currently spent by Medicaid in rural America. If you live in rural America and you're watching this show right now, your life expectancy is 3 years shorter than your fellow Americans watching in urban states. That's not right. Your zip code should not be your destiny. We're fixing that.
Medicaid. I'm well-versed in budget politics, Dr. Oz, to know that a reduction in a future increase is not a cut classically defined. But that doesn't mean someone might lose a benefit that they're currently enjoying, and it's cold comfort to them to be told it's not a cut. What is it? What happened in the Big Beautiful Bill to Medicaid? Because the political argument is it's a ravaging, damaging, gutting cut to Medicaid services.
The truth is that we're spending $200 billion more in Medicaid. And to your point, what was designed was to take us back to a peacetime. What Medicaid spent 50% more money over the last 5 years because of COVID. All the rules that were changed to accommodate the national emergency, our war on COVID, needed to be reversed. We're not at war anymore with the pandemic. You can't keep spending money the way you would during a pandemic. Let's provide the right incentives to go back to the way the system worked just 5 years ago. We didn't go back 25 years. The one difference, the one thing I feel passionately about is this country thrives because it works. When Medicaid was founded 60 years ago, it never crossed anyone's mind we would not ask able-bodied individuals to be on Medicaid or to work if they were on it. Every social network safety net program has work as part of it. President Clinton had that, Obama, Clinton, Biden, every Republican president. So we put a work requirement in to encourage people to get out of the house and get to work and live your life's destiny. That's what you're on this planet to do to change the world.
Dr. Oz, I appreciate you coming in. May the conversation continue.
God bless. Same.